Hello everyone, I'm Marla with 9 Health, and thanks for joining us for today's edition of Health Happens. This is our weekly show where we're bringing you objective, unbiased health information on things and news that you really need to know and that you care about. And so this is our show today. We are here at the Safeway Pharmacy. We're joined by Nikki Price, a registered pharmacist, easy for me to say, and oversees all the pharmacies in Colorado. And so we are lucky to be joined by you today, and we're talking about an important topic called measles. So you probably heard about measles. There's over 760 cases last time I checked, and luckily there's only one in Colorado. But we're going to talk about that in a little bit. We're going to get to that. The first thing we want to know is about measles, right? So you are somebody, and I think people don't realize that pharmacists actually are a wealth of information.
Right.
You're very accessible. You can walk up to this pharmacy at any time and ask a pharmacist questions, and you guys have the training and the knowledge to be able to help people. So tell us, what is measles? Why should we care about this? I mean, everyone's talking about, oh my gosh, there's an outbreak, and you know, I remember having a vaccination when I was a kid, and it didn't seem like that big a deal. So what is this measles? Tell us that.
So measles actually is a virus, and some of the symptoms that it causes are high fever, so over 101 degrees, a cough, a runny nose, watery eyes, and then usually a couple days after those symptoms start appearing, you see a general rash. But the telltale symptom are what are called Copwick spots, which are just white little spots on the inside of your mucous membranes, typically on the inside of your mouth, inside your nose, nasal passages, and that. That is really the telltale sign that says, yes, you have measles. But the most important thing about measles is that it is one of the most highly contagious viruses that is preventable with a vaccine.
Okay. And I'm sharing this on the 9 Health page, so I'm not being rude. And if you have questions for us, if you want to know something about this topic, measles, and the immunization for that, we just talked about that, please type it in. We'll keep an eye out for your questions, and we can answer those questions at any time. So go ahead and send us your questions if you have them for pharmacist Nikki Price, and we will be talking a lot about measles. You've let us know what it is, and that it is preventable,
Right.
which is important. 9 Health is all about prevention, and so there has been an outbreak.
Right.
Why has that happened?
Mainly because our vaccination rates have dropped. So in the year 2000, the United States actually proclaimed that this has been eradicated.
Right.
Because immunization rates were really high. And as vaccination rates have dropped and people have been exposed by going to other countries where vaccination rates are not as high, they brought it back to the United States, and it's starting to spread.
Okay, so I was sharing with you a little bit before about, I remember being a kid and being kind of, we all got in a line and we marched down to the gym. I don't know how many remember this, and you know, you got your shot. Everyone just got their mumps shot, and then there was another thing you had to do, like
Right.
What was it? It was a sugar cube.
Right.
It was a sugar cube. So, and that doesn't happen anymore.
No, because typically it is a parent's choice, and they take their child when they're a baby and get a number of vaccines, you know, depending on what age they are. But the measles vaccine is usually given between 1 and 4 years, and it's a 2-dose series.
Okay. And what is the reason? What have you heard why parents aren't getting their children vaccinated?
There's a number of reasons. Some is just parent choice. They don't want to put a foreign body into a child's body. Some religious reasons. Also, though this theory has definitely been debunked, is autism. That vaccines cause autism, and there was some poor research put out there that indicated that, but coming to find afterwards that research actually was flawed.
That's right, and that doctor has been disbarred, I heard.
Correct.
Yeah, so I think that's one of the things that's been debunked, but there are also other reasons maybe for parents. Tell me what the fears are, and are they real? I mean, is there really any side effects or harm from getting the measles vaccine?
Sure. So some of the side effects are with any vaccine or any medication that you may take always has some type of side effects. Because this is a live vaccine, you may see a very small case of not necessarily measles, but you may have the runny nose, you may have the cough, and you may have a low fever. That will only last a few days because your body is just building the antibodies to it.
Okay. Okay. So there's very little side effect, but you may get some kind of
like a cold type symptoms.
Colds. Okay. Okay. We have some good questions here. Thank you guys for writing in. So Laura would like to know, how do you protect babies who are not old enough to get vaccinated yet? That's a great question.
That is a great question, and basically it's trying to just keep them away from individuals who may have been exposed someplace else. Those people who maybe have the measles or been exposed to the measles and will expose others who have not been immunized or who have poor immunity because of previous vaccines they received, 90% around them will have a chance of will probably get the measles.
Oh, wow.
So really keeping them away from individuals who may have been exposed to some of the epidemics or some of the outbreaks that have occurred.
And you might have said this already, but it sounds highly contagious when you said 90% of people.
It is the most highly contagious virus that's preventable.
Yeah. And by us getting vaccinated, is that helping babies at all that can't get vaccinated in vulnerable populations?
It absolutely is. So many of us, we receive the vaccine. Anytime you receive a vaccine, not only are you protecting yourself, but you are protecting others because you can't spread it then. You can't expose others.
Yeah. And Laura actually has said that as well. It's herd immunity. Is that a term you're familiar with? Or
yeah, herd immunity. Yeah. So herd immunity is basically when everybody's immunized.
Yeah.
It's causing immunity for everybody around.
Yeah. Okay. Great. So if you live in a high infection area, they say that they'll give the vaccine before their first birthday, or if you travel a lot. So she's giving that advice. Is that something that's true?
That is true.
Okay. Okay. Great. So thanks for that, Allison.
Yeah. So many times, because of the lower vaccination rates in other parts of the world, that's how actually the measles came back to the United States.
Okay. Okay. So there, of course, whenever we talk about vaccines, I think there are those people that still, say the CDC just lost a court case, and there's really the idea that we're just there's still some danger with that vaccine. So as you said, it's a parent's choice.
It is absolutely a parent's choice.
And you were telling me a little bit ago that Colorado has a low vaccination rate.
So United States has a 90% vaccination rate for measles. Colorado is at 87%. And the research out there shows that to prevent an outbreak, we really need to be at 95%. And so Colorado could potentially be prime if the measles were to come into the United States.
And you said that it's vacation season right now, and people are traveling, and so
school's going to be letting out here in the next couple of weeks, and that's when a lot of summer vacations start occurring. And whether you go in or outside the country, obviously this measles is starting to make a lot of media attention and some headlines.
And what can you tell us about the safety of the vaccine? I know you kind of repeat this a lot, but we do keep getting questions. So what can you tell us about the safety of the vaccine?
So any of the vaccines are all approved by the FDA, and then also CDC puts out their guidelines as to who should have it, when you should have it, and so on. And there was a lot around the autism. Obviously, we talked about that theory's been debunked in that. But overall, yes, vaccines are safe.
Okay, thank you. So we do have Sarah saying, the side effects are minor compared to the potential for pneumonia, encephalitis, and death if you contract measles. So is that accurate?
That is accurate. So measles can lead, especially to those who may be immunocompromised, could lead to pneumonia, could lead to encephalitis, and many lead to in that group can lead to hospitalization as well too.
Okay, so important if you can. So if I was vaccinated when I was a kid, how do I know if I need another vaccine or if I need a booster, or how do I know if I'm still
so it's actually not called a booster. It's actually really just getting revaccinated. So those who were born before 1957 have natural immunity, because measles was pretty many epidemics widespread across the United States.
So that's one good thing about being born before 1957. You're naturally immune.
Exactly.
Okay.
The vaccine came out right around 63 or so, and between 63 and 67, someplace 68 or 69, it was a different vaccine. It was what's called an attenuated vaccine that has a much lower effectiveness rate. And if you know what vaccine you received, that's great, and then you can make a decision whether you need another one. If you did have the attenuated one and you know that, you probably should get revaccinated is the recommendation.
And you would have gotten the attenuated one between what years again?
Between 63 and 67, maybe 68, 69, depending on your healthcare provider.
Okay, so if you're in that date range, you probably want to get re-immunized.
It would not be a bad idea, too.
Ay, that's neat. Okay,
it's just a small pinprick. It doesn't hardly hurt at all.
I know, right? It's a small price to pay.
Right.
Yeah. Okay.
To protect others.
To protect others. Yeah. I'm just maybe a little bit of a weenie. So anyway, so we covered how contagious the measles is, which is really contagious. And so, You talked a little bit about what are the signs and symptoms, but maybe cover that again so people can be on the lookout if
Sure.
they see those signs.
So if you're exposed to the measles and you have not been immunized or you have a poor immunity because of a particular vaccine you received when you were younger, about 10 to 12 days after being exposure, you will see a runny nose, a high fever, so over 101 degrees, a cough, a runny, watery eyes, what's called conjunctivitis, and then a rash appears anywhere between 12 to 14 days after exposure. A generalized rash, and then lastly, the telltale symptom of complex spots, which are on the inside of the mucous membranes. The danger with all this is that because signs and symptoms don't show up between 10 to 12 days after exposure, you have about 4 days prior to those spots showing up that you could be exposing others and you don't even know.
You don't even know you have it.
Right.
And you're walking around, so the symptoms don't show up for 10 days.
Right.
Oh gosh, I didn't realize that.
Yes.
So good reason to get vaccinated. Again, another good reason. But
Right.
you know, I do have some questions here,
Okay.
and again, it's a lot about kids. Would it be recommended to request it before a child turns a year? I think our doctor waits until 1 year, and our guy is 5 months old, so they have a 5-month-old child.
Sure.
My sign's falling down, but keep going.
So the CDC recommends at 1 year of age, so that's why the healthcare provider is waiting till 1 year. If you were in an area that has had an outbreak, I would definitely call your provider and see if they would move that up. In addition, or if you're going to be traveling, especially outside the United States.
Yes. But so far, Colorado only has 1 case.
Knock on wood,
So
yes.
yeah, so far that's good. So Susie, you might not have heard us. She says, I heard that people born between 1959 and 87 should be revaccinated. You gave the right dates. What's
63 to 67.
63 to
between 67 and 69, but
Yeah.
those are the years that there was an attenuated vaccine.
okay. And you said there's no such thing as a booster.
No such thing as a booster. You just get revaccinated. So if you fell in that age group and you wanted to get revaccinated, or you felt the need to do so, even if you fell outside that range, or you just don't know what your immunity is, you actually do just get re-immunized with the normal vaccine.
And there's no harm if you are still immune to it and you get a measles vaccine.
No, it's not going to hurt you.
Okay. And is there a thing where you could get tested to see what your immunity actually is, so that you know whether or not to get
Through
this?
your healthcare provider, you can do that. In many cases, sometimes it's just easier to go get revaccinated. And
Yeah.
you can do so at any of our pharmacies, and also receive a 10% off coupon for your groceries at the same time.
Okay, good. I lost my comments, you guys, so I'm trying to find them again because there was a lot of good people who had questions, so bear with me. You know, we covered this a little bit, and I think that people are still wanting to hear, you know, a little bit more about the sentiment of that the vaccine could cause more adverse effects than the actual measles disease itself, virus itself.
Right. So again, it's a live vaccine, so you may, and this may not be everybody, but there's going to be a percentage of people that may see some symptoms similar to measles, but a much milder case. So a low-grade fever versus the high fever, and again, that's your body's reaction to building those antibodies against the measles virus. But again, that would be it in terms of that. And maybe, you know, when we gave you the shot, you may have just, you know, a little soreness in your arm, just similar to any other vaccines. But outside of that, you're protecting yourself, and you're protecting, more importantly, others around you who may have low immunity and don't know it.
I think that's the biggest factor for me, anyway, is that even if I can handle getting the measles, right, or even if it's the flu, because I'm pretty healthy and not that old yet, that I feel very good about not getting vaccinated. But when I consider that when I'm walking around, I could be, you know, putting other people at risk, elderly and babies and immunocompromised people, that is influential to me, and it might not be to others, but when you tell me that, I get like, okay, well maybe we should really
because in that way, because if you were exposed, again, like you said, if you get the measles, and there's going to be that time period that you
don't
may
know.
not even know that you could be exposing, you know, that 5-month-old little guy that we certainly don't want to get.
Right. So last thing, people want to know, can they get the vaccine at the pharmacy? And you said yes.
Yep, they certainly can. I have actually a box right here, and it's actually a little bit different shot than if you've gotten a flu shot before. You know, you get that in your muscle and your arm. Typically, this is a subcutaneous shot, so it just goes right underneath the skin, so it's a little bit less painful. You don't get that muscle soreness as well. You might just feel that little pinprick at the time.
Okay, well, I'm gonna do this when we go off. So, thank you so much for all this information. And we know that this is always something that people have different viewpoints on, and so we respect all those viewpoints. And we want to give you
Absolutely.
the real information from a real, pharmacist, and then it's up to people to make that choice.
Absolutely.
For themselves. But thank you for joining us. This is Health Happens. We are going to sign off here in a minute. We have next week. We're going to be here again Tuesday at 11 o'clock. So join us, tune in, and keep sending us your questions. We'll try and answer them. Thanks so much.
And if there are more questions, feel free to call your pharmacist. We're happy to answer
Good
those.
point. Yes, thank you.